China top epidemiologists, as I said when I started the show, they're predicting that 60% of China's population could be wiped out. 10% of the Earth's population could also be wiped out. Infections could be in millions. So the concern for India is what is happening globally, unfortunately, will not be restricted to just those parts, but will have a pattern, and we will see infections rise in India as well. At that time, if you're having public rallies, if you're having large gatherings, isn't it the responsibility of people, political parties, to have caution themselves? So if in that backdrop, the health minister has written a letter, what's the problem?
Absolutely, you're right. In the backdrop of raising numbers of COVID patients in China, we have to take precautions. I understand that he has written to Rahul Gandhi ji to suspend the Bharat Jodo Yatra. All health related issues should come from concerns that is health related and not political reasons. Decisions should never be based on political reasons, because couple of days ago in Agartala, our honorable prime minister had a huge program where there were thousands and thousands of people who had gathered, correct? So why was it that it was not a provoking, or it was not a health concern? Why is only the Bharat Jodo Yatra a health concern is one of the questions. Also, yes, we agree. We have to follow the COVID rules and regulations. If we are asked to do that, we will follow that. But at the same time, are COVID protocols being followed in airport, railways, malls, pubs, and other public places? Why isn't the health minister addressing that? What is the health protocol that is being followed across the nation? There should
But
be something, not just for the yatra, but for the entire nation. Isn't it an emergency that he should be issuing protocols for the
So I heard
entire
you
nation?
patiently,
And what
Lavanya. And this is where I
Mhm.
have a bit of a problem. And we have RP Singh of the BJP also now joining us. So good to have you on the broadcast with us. But Lavanya, we heard from the health minister today. He even briefed the media personnel. He said that I had numbers to work with. I knew that yatris in this Bharat Jodo Yatra were turning positive. So in that backdrop,
Mhm.
the worry was that if there are already people who are COVID positive, they will be spreading to
Mhm.
other people. Then why should the health minister be targeted? Because he's not speaking as a spokesperson of one political party. He has accountability to the country.
Absolutely, you're absolutely right. He's accountable to the nation. That is exactly why I'm asking you how many people were tested who turned up at the Agartala meeting of the Prime Minister, the public meeting. How many people have been tested? And if they have not been tested, why haven't they been tested for COVID? And also, as a health minister who is answerable to the whole nation, what is the COVID protocol that he is issuing for the nation? That is his duty, that is his job. He is responsible for the lives of 1 billion Indians. Why isn't he issuing an health protocol for the entire nation, and why only for the yatra? We have no
RP
issues with
Singh
the health protocol
respond.
that is
RP
issuing
Singh
us.
respond to the criticism coming in from the Congress. They're saying two things. One, they're saying that there are no official protocols and guidelines in place, so we don't know what to follow. The other example that has been given by the Congress is that look at what the BJP is doing. The Prime Minister had a rally in Tripura just a few days ago. There is currently a Jan Akrosh rally that is taking place as well. So is the BJP trying to say that COVID is following only the Congress's yatra?
Well, the letter is to Mr. Gehlot also. He should take care of the Janakrosh rally also. Of other regard, Mr. Kejriwal can also take care of the yatra which has to come to Delhi, because the health is a state subject. So they should also take care. Yeah. Now it's no more that the countrywide thing which is happening, only because there have been cases which have been reported from the yatra, Bharat Jodo Yatra. That's why the issue was picked up, and then the message was sent. It's advisory to the organizer of Bharat Jodo Yatra. Now it's up to them to decide whether they want to continue with it, or whether they want to take precaution or not. Tomorrow, at least, something happens, they can't come back to us and say, or come back to the government, sorry, and say that, oh, the government didn't want us. But it's something like what happened with the Tablighi Jamaat also. So we don't want, we can learn from the history, and then we shouldn't repeat what has happened in history. So it's just an advisory. It's not that it's mandatory for them to follow it or not. They don't want to follow it, let them not follow it. Let people judge them by just that they're not following the
No,
request
but
made by the minister.
RP Singh, the point that I think the Congress is making, and this is something they've been reiterating the entire day, that we don't have a problem with actually following the guidelines. Till now, there was no guideline, so we didn't know what to follow.
is there a basic guideline that why I'm doing this debate from Skype? I've not refused your cameraman today because there's a problem today. We've all been through this. Wearing a mask is mandatory in public place. Washing your hand or sanitizing your hand is mandatory now. So these are few things which we have learned now. I mean, every Indian knows about it. So nothing wrong in it. I mean, and also that the Himachal Chief Minister was there other day, and he has gone back with Corona now. A man was supposed to make certain announcements within 10 days. Now that will be delayed. The people of Himachal will wait for those announcements which were to be made in 10 days because he'll have to be confined to his room now.
Okay, so I think
certain
the point that the BJP is making is that why are you waiting for official guidelines to come in, considering the fact that we've learned a lot over the last couple of years? Shouldn't it be our own responsibility to follow the basics? But I want to bring in the expert on the panel, Dr. Rajib, also in the conversation. Dr. Rajib, of course, those videos that have emerged from China have created a bit of panic, anxiety, because we all thought that it is behind us. Unfortunately, now we feel that it's not over. This current strain that we are seeing, which is now being called BF.7, we are seeing certain cases being detected in India as well. What do we know so far about this strain and its severity?
Thank you. What we know about BF.7 so far are as follows. One, that it's certainly driving major surges in some of the key cities in China. Second, that this Omicron subvariant spreads far more rapidly than the Omicron variant. Third, that it does not produce a disease that is significantly different from Omicron, but what's happening in China is that because, or at least that's the current understanding, that because the population is largely or relatively immune naive compared to the Indian population because of their zero COVID and then later dynamic zero COVID policies, the impact felt in China is much higher. Remember, the first Indian BF.7 identified by GBRC Gandhinagar actually dates back a couple of months.
Okay.
And that really is the sense that we are getting from China.
Do we have a sense, doctor, of the doubling rate? Because last time around when we spoke to experts, they said that is an indicator that we need to watch closely. Do we know how fast it is spreading?
Yes, the BF.7 has an R0 value of anything between 16 to 18, and therefore it spreads very fast. Also, it has a pretty large proportion of subclinical cases, so that plus a very high transmissibility is something that China is really battling with.
Okay. So, Lavanya, there you heard from the expert, and I'm not saying this, the BJP is not saying this, but we are worried at the doubling rate. We are worried at how fast the infections are increasing, and does that worry in India as well. Today, we heard from the health minister, and he said that I've been attacked by the Congress all through the day. I'm trying to understand if the health minister, who, as I said, she's not the representative of a political party, but has responsibility of the entire country, if he writes a letter with the context of China cases, why are we seeing such extreme reactions from the Congress? Because the mandate was very, very clear that you follow certain guidelines, otherwise you halt the yatra. So what is the guarantee that the Congress is giving that we will not see this becoming a cluster zone?
So we have not said we will not follow the COVID protocols anywhere. All we are asking is, while you give us the COVID protocols for the yatra, why haven't you done the same thing for the people who attended Prime Minister's program? Why haven't you issued a protocol for the rest of the nation? That is all we are asking. We are not asking him why is he doing it. We understand why is he doing it. It is his duty to give us the protocols. All we are asking is, why is there a lacking of protocols for the airports, railways, train stations, bus stations, schools, colleges, public places? Why is there a lack of protocol for marketplaces, the malls, the cinema theaters? Why is there no testing that happened at Agartala? It all should happen, right? We are not saying we will not take precautions. We have never said that. All we are asking is, the same yardstick has to be used for everybody. That's all.
RP Singh, what I'm finding it very difficult to understand, and I will let you respond, that have we not learned anything? Because I want to go back to the peak when we saw the previous waves as far as the Bengal elections were concerned. Even that time, we saw political parties and the BJP included, they continued to campaign as the cases were peaking. And post that, political parties said that there needs to be lessons that need to be learned. So this time around, why aren't we seeing a more accountable set of politicians and representatives on the ground?
Well, Ridhima, there are lessons to be learned from the past, and then probably we have to learn those and move forward. I just now said probably Bharat Jodo Yatra will turn out to be another Tablighi Jamaat. They want to go by that route, they can. We can't stop them. Only thing is we can advise them, and the state health ministers, wherever the yatra has to go, can take care of it. But one part is there that in Bharat Jodo Yatra, there are people from various states coming and joining it. And because of that, the people who go back to their respective states is a problem. When he's talking about particular event, that's confined to their state, and the state need to take care. And also, whenever there's a problem, I mean, if government has taken action on it, if today they have taken action, now onward, everyone will have to follow that. Simple.
I would like to just
rebut
for this.
Can I please? 2 days back, something happened in Tripura. I mean, that was 2 days back. If today there's an emergency, meeting has been conducted, there's a feedback, and on that basis, a call has been taken. I mean, if this would have been the case, the government or the health minister would have spoke about this a week back about the Bharat Jodo Yatra, when it was in Madhya Pradesh, when it was in other states.
You know, Lavanya, essentially the point that the BJP is making is this, that for how long can you continue to compare what happened last week? Because this is something that the virus has taught us over the last few years, that it mutates, it changes its pattern, and no 2 days are similar. So today we feel that the situation is dire because of the kind of cases that are being reported from China. So today the guidelines are being put. Is it really fair to compare it to what happened 4 days ago?
He's constantly comparing the Tablighi Jamaat. I would like to remind him the health minister then had not issued any restrictions, travel restrictions to the people who came to the Tablighi Jamaat. So I think you are either purposefully missing the details or you are hiding the lack of enough work that went into the restrictions that happened during the previous COVID seasons. The government had failed the people of this nation by not issuing proper travel protocols. We were not equipped at the airports to screen people. A lot of times the screening was very haphazard. Until the COVID really numbers rose in the nation, we were not completely equipped even for basic screening. So tell me, when the first COVID season hit, we were doing Namaste Trump in Gujarat. What are you talking? What are you comparing about previous seasons of how the government has handled COVID? It has failed in the handling of COVID the last 2 times. Rahul Gandhi multiple times had reminded us that COVID is going to be a problem for us, and they all mocked him. They trolled him for that. This is what we are asking even now. Why aren't you issuing COVID protocols to the public places? You are issuing it to Bharat Jodo Yatra, fair enough.
I think that's a fair point that Lavanya is making, and I will just go to Dr. Rajib also in just a bit. RP Singh, I think that's a fair point that Lavanya is making, that how come when you talk about guidelines and protocols, it only comes down to the Bharat Jodo Yatra? How come we're not seeing testing increase? And this is what most experts are saying, that our guard is down, we're not testing enough, we're not talking about people taking the third dose or the precautionary or the booster dose. How come everything as far as protocols is just boiling down to the Bharat Jodo Yatra? So then the criticism coming in from the Congress is, this is just a rattled BJP because of the success that the Yatra is seeing. RP Singh?
Well, as already said, can you hear me?
Can hear you, go ahead.
Yeah. As for success of Yatra, Kamal Nath son has already said that they did a better Yatra and they pulled a better crowd than Bharat Jodo Yatra. It's not me, the Congress member parliament from Madhya Pradesh, and the son of the former chief minister said so on record, and he's a congressman also. So we don't want to get into this issue of whether Bharat Jodo Yatra is success or not success, and it's nothing to do with Yatra as such. The issue is, and also the Tablighi Jamaat also was blatant for not accepting the guidelines, and then same. I mean, we are advising you that please take care of the protocols, basic protocols, which is wearing a mask, or ensuring that there's sanitizer being used in the Bharat Jodo Yatra. Very basic. I mean, if you want to deny it, you can deny it. But again, they want to see everything with a political dimension. It's not. It's issue of healthcare. It's the same sort of people who said, oh, this vaccination is is not proper. There is something which is not good in this vaccination. We'll take the vaccination at the last stage, whether we see whether vaccination serves the purpose or not. There is a lot of questions from the scientists and the doctors of the country.
Okay.
So today they are again doing the same. They are again questioning the people who sat down in a meeting. Was not the politicians. It was the scientists, doctors who were part of the advisory committee to the health minister, and then whatever they would have advised, the health minister would have passed it on.
So the point that the BJP is making is that why is the Congress politicizing what could potentially be a health emergency? And I'll let Lavanya respond to that in just a bit. But I want to bring in Dr. Rajib back in the conversation. Dr. Rajib, if we were to draw patterns from what we are seeing in China, one of the big factors that are being pointed out by experts is that vaccination is extremely low as far as China is concerned. Their efficacy of vaccines is also being questioned. Compare that for us to the vaccines that we have in India and their efficacy as far as this new strain is concerned.
Yes, both the coverage as well as the efficacy of vaccines in China has come under some scrutiny. And therefore, when we compare it with the Indian situation, we have done extremely well with the vaccination program. The quality of vaccines that we have used have proven to be efficacious. Our immunization program in general has very strong fundamentals. However, the uptake of booster in India has been low till date, which is about 30% on the average. And the lack of a booster may render the elderly and those with underlying comorbidities relatively more vulnerable. But India also has the advantage of having a very high natural infection rate plus a very high vaccine coverage, and that has in fact seen us through the Omicron phase, and the BF.7 is likely to be no more different than the BF.7, except as I said, if some have extra vulnerabilities. But by and large, I believe India would pass through this phase pretty well.
Well, that's heartening to hear. I want to, touch upon another point quickly with you, which is you spoke about the low rate as far as our precautionary dose or our boosters are concerned. So, of course, that will be the priority to try and get more people to come forward. But where things stand, most of us have taken 2 vaccines plus a booster. So, will that be enough for now, or do you think we'll have to go back into that cycle of getting another booster?
No, at the present moment, there is no talk of a second booster or 4th dose. What this entire combination of a very high level of natural infection, which is marked by seroconversion before the vaccination campaign began, plus 2 or 3 doses of vaccine, is going to protect us against hospitalization, severe disease, and mortality. Again, that's by and large the rule of thumb. There may be exceptions, of course, but by and large, that's what the Omicron experience is. And BF.7 is an Omicron variant, but there is a caveat. There are studies now emerging that even those with 3 doses of vaccine and natural infection, this BF.7 has demonstrated immune escape properties in them. But whether that will lead to a catastrophic situation in India, I don't think so, because the underlying immunity in China is relatively more immune naive than the Indian population.
Well, that's heartening to hear, but we'll again, of course, tell our viewers that it's not over till it's over. So do go back to your basics. But going back to the political representatives, and Lavanya, I don't have much time left, but the point that RP Singh was making before I went to the health expert was that, this is a pattern that we see with the Congress party. Anything that's done with the right intent by the BJP is politicized by the Congress party. Look at the comments that Rahul Gandhi has made for our Fauji's and Jawans. And now even when we have a health, emergency, the Congress doesn't seem to be taking it seriously.
Let me put the record straight. Mr. Gandhi has never made a negative comment about our army or armed forces. He has questioned the BJP as his right. as an MP of this nation to question the BJP. And every time we question the BJP, it is not us questioning the armed forces. There is a difference there. And also, when it comes to the COVID protocols, here's what I would like to know from Mr. R.P. Singh. Are we ready? Do we have enough booster shots in the nation? Because we have seen how last time people had to scramble around for oxygen tanks and for vaccines. So is the nation prepared? Is the health department prepared with enough number of booster shots? Are we prepared to battle COVID if it becomes a huge COVID wave like last time? Do we have enough infrastructure? Do we have oxygen tanks? Do we have enough healthcare workers? Do we have frontline workers this time?
Okay,
That
RP
is the
Singh,
challenge
RP
that
Singh,
BJP
please
should be
respond to
answering.
that. I have 30 seconds left. RP Singh.
Well, I have simply one thing to say that, Lavanya, I hope you have taken a booster, and Rijama, you also have taken a booster. That's more important than anyone else, because if people like us who are sitting on your panel have boosted, then probably this will help send a message across. One. Secondly, I wanted to understand what WHO has to say about India, how India has done well on corona with this big a population, and ensuring that everyone has a vaccination, and also 30% population has got a booster also. There's no dearth of the vaccination goes, and we are probably also supplied a lot of vaccination to other countries. But again, I request Congress Party, don't take it, make it a political issue. It's an advisory.
Sure.
Don't behave like tabligis. You're a party. You're a political party, sensible political party, opposition party. Don't conduct yourself like some unimportant organization.
Okay. Unfortunately, I'll have to leave that conversation there. I have taken my booster, and we will request our viewers, those who have not, also to go forward and take their precautionary dose, because as the expert on the panel said, unfortunately, it's still not over. I'd like to thank all our guests. We are slipping into a very short break. Don't go anywhere. We're coming back with lots more.
Is underscored by the presence both in Afghanistan and in the region. Concerns have been expressed that the group has reversed policies and gone back on commitments made prior to assuming the power. Now, Abhishek continues to be with us. Abhishek, this is India registering some strong protest about the developments in Afghanistan.
Yeah, Vinaya, and everything that happens in Afghanistan is a concern to India, because everything that is bad in Afghanistan society will spill over in some time, and it will start impacting Indian territories as well. You can talk about terrorist organization, radicalization, the kind of society that Taliban wants to create, where women are not allowed to participate in the social activities. So this whole radicalization and harboring of terrorist organization and individuals is something that India is very concerned about. It has raised this issue in past also, and now with Taliban increasingly coming out with their strong radical and Islamist, so-called Islamist way of ruling in Afghanistan, it is a clear concern that the soil of Afghanistan will now be a very safe haven for various terrorist organizations that have been operating across the globe, especially Al-Qaeda, which has had a very close linkage with Taliban in the past. But this time around, Taliban has been trying to distance itself from any global organization of which is involved in terrorist activities. They have tried to, express a face where they try to become a Taliban, a little modernized, little moderate, and with inclusive also. But with each passing day, it is actually unmasking itself and bringing out its worst fear of in its neighborhood, where people had always anticipated that Taliban had not changed fundamentally. They remain the same. They are same radical, fundamentally regressive group of people and clerics who would try to repress society and rights of women. And there will never be an inclusive society as long as Taliban is at the seat of Kabul. And terrorist organization will continue to flourish in part of Taliban, Afghanistan and Pakistan's border. And that remains a key concern, a security concern for regional parts or countries in the region, including India.
The US condemns Taliban's indefensible decision to ban women from universities, to keep secondary schools closed, and to girls to continue to impose other restrictions on women and girls in Afghanistan to exercise their human rights and fundamental freedoms. US State Department spokesperson Ned Price said in a statement that Taliban's decision to close secondary schools to girls last March has had a significant impact on our engagement with Taliban representatives. Taliban made promises to the people of Afghanistan and to international community that schools would reopen. Now, to get us more details on this, Abhishek Jha continues to be with us on the bulletin. Abhishek, that's a strong statement coming in from the US government now.
Yes, Vinaya, and also we'll have to see that these statements are coming at a time when Taliban is starting doing all that it was anticipated or people were fearing of that Taliban will start doing these things. There were a lot of opinion and experts try to allay those fears of Taliban and saying that let them have another chance. Maybe Taliban have changed. Taliban the 2-0 have little moderate views on the fundamental aspect of his theology and ideology. But it looks like with almost more than 1 year being there in Kabul, Taliban is strictly trying to implement what it was fundamentally an organization of very conservative theories and conservative concepts regarding society and how it should operate. While it is having a relation with some countries in the
Welcome back. Thanks a lot for staying with us. The Taliban's de facto authorities have banned women and girls from attending universities and getting higher education in Afghanistan. According to the letter which has been released by Taliban's Ministry of Higher Education, which is effective immediately, completed all the restrictions in the Taliban imposed on Afghan women's life in the 1990s, taking Afghanistan and Afghan women nearly 3 decades back. It says, based on cabinet decisions, education for women is suspended until further notice, unquote. Remember, the Taliban recaptured power over 15 months ago and immediately deprived girls of their fundamental rights by banning secondary education for grade 6 and above, but women were allowed to attend universities in a gender-segregated class. No country in the world currently recognizes the Taliban government. Rumors of closing universities have been circulating on the Afghan social media since a new leader was appointed for the Ministry of Higher Education position. The international community, of course, has condemned this decision. In a statement that was put out by the US Secretary of State Antony Blinken, he said that the United States condemns in the strongest terms the Taliban's indefensible decision to ban women from universities, keeping secondary schools closed to girls, and continue to impose other restrictions on the ability of women and girls in Afghanistan. Remember, when the Taliban came back to power, they had made claims of being a softer Taliban. But with the kind of developments that we are seeing, have we gone back to the dark ages? So if you're a woman or a girl in Afghanistan, this is how your life looks like. Let me just talk to you about the diktats and the restrictions that the Taliban has already imposed on women after they came back to power. Banned from university education. Remember, school education was already an issue, and now you won't get university education as well. You're also banned from gyms and public baths. But that's not all. There is also a diktat as far as public pass and fun fairs are concerned. If you step out, you need to have a male representative with you. So you can't travel without a male escort. So you just don't have freedom. Banned from acting on TV as well. Even for news anchors, as far as Afghanistan is concerned, you can't anchor without covering face. So this is what the diktats currently look like. As I said, the international community, of course, has condemned these decisions. Let me quickly run you through some of the decisions and the reactions actually that we are seeing. from US Secretary of State Anthony Blinken, deeply dismayed by Taliban's announcement. But it's not just the United States. You're also seeing a reaction from the Prime Minister of UK, Rishi Sunak, saying denying access to university is a grave step backwards. And he's in fact used his personal life experience saying, I have daughters and I find it unimaginable if you restrict women from getting education. As far as the UN spokesperson is concerned, saying another broken promise as far as the Taliban is concerned. And this is what I said. When they came back to power, they said that this time things will be different. What really has changed? Nothing, is what people on the ground say. As far as UK's UN ambassador is concerned, this is what she has to say. No prosperous Afghanistan without fair justice system, because you are actually restricting half the population from getting education. What really is happening and what can the international community do? Let me bring in our guests as well. We have Fawzia Kufi, ex-Afghan lawmaker, author and women's rights activist. We also have senior journalist and scholar James M. Dorsey. Good to have both of you on the broadcast with us. James, I'd like to begin the conversation with you. First school education, now university education. Are we really surprised?
Not really. I think what we're seeing is the rise of the hardline, more conservative elements within the Taliban. And the reason for that, I think, is twofold. One is that engaging with the outside world and trying to put forward a more inclusive face has failed since the American withdrawal from Afghanistan in August 2021, as well as the takeover by the Taliban. The international community across the board, not just the West, but also China and Russia, have not really been willing to engage as long as there is not an inclusive government. And that hasn't happened. I think the second reason is that the Taliban have not been able to counter the Islamic State in Afghanistan. And that, of course, is a conservative and hardline challenge to the Taliban.
Fawzia, I want to bring you also in the conversation. You, of course, have been very vocal as to how the situation is only deteriorating in Afghanistan. What are the kind of emotions that you're feeling or experiencing today?
Yeah, I'm surprised by some of our commentators who say Talib can dismantle Daesh or ISIS-K. No military extremist group actually can dismantle other one. And the world has absolutely been engaged with Taliban. In fact, their back-to-back restrictive measures on women is being empowered by the world engagement, regardless of their track record and their deeds on the ground about women's rights. They have had meetings at high level with international community. $40 million go to them every week. The region has been engaged with them. India has their own embassy open there. Pakistan has the embassy there. Russia has the embassy there. So I don't really know what does it mean when we say engagement. From somebody's perspective who has spent all my life in Afghanistan except few last months and invested my blood in Afghanistan, I don't believe that giving more privilege to Taliban will actually respond. I think there should be a political pressure, and that political pressure should be unified by all international community, including countries in the region. I think different countries have a security-centric approach because they want to keep their borders safe. Okay. As long as their own borders are safe, they want to give bribe to Taliban. That is not going to work.
So you're saying the international community just cannot be silent and mute spectators. There needs to be more pressure politically. I'll just get to that in just a bit in terms of what the international community can do. But I want to just take a step back. And James, what I want to understand is, and this is what we've been saying, the Taliban said it will go quote unquote softer this time around. With the kind of diktats that continue to come out, can the Taliban really expect to be a legitimate member of the international community until the fact they decide that they have to respect the rights of Afghans, women included?
I agree with you on that. What I'm saying is it may very well be that they no longer expect to be a legitimate member of the international community. We're now 18 months after the U.S. withdrawal, and the international community has not engaged with the Taliban by and large. They haven't recognized the Taliban government. Most countries still do not have diplomatic representation in Afghanistan. There's no humanitarian support that goes through the government. So on all of those counts, it may very well be that the Taliban just simply figure it's not going to work. They're going to have to do this on their own. And that's when you get more conservative forces having the upper hand, particularly when they're being challenged by militants.
Fawzia, speaking specifically from your own experience and what this means for girls and women, just a couple of weeks ago, you had this very heartwarming video of an Afghan child and a girl who said all she wanted to do was to study. Today, looking back at videos like those, or looking back at the future of girls and women, how many dreams have been shattered today?
Millions of dreams. And I really don't want to play this victims politics anymore. We have really been victimized by different powers at different level by different countries. I think the world really has been so much engaged with Taliban that engagement boosted Taliban's position. Remember that the Taliban were brought to power after the deal that was signed with them by the United States. And let's not forget that in that deal, there is no one word mentioned about human rights and women's rights. So the people of Afghanistan feel that they're being betrayed by international community. Every week, $40 million go to the Central Bank of Taliban without any checks and balance. There is more than $1 billion only the U.S. support to humanitarian aid. Taliban claim that they have increased the domestic revenue, apparently. Let's believe that. If that is correct, where is that money going? They're spending money to empower their military actions and to train their military section of the Taliban. They feel no responsibility towards the people, and they want the rest of the world to feed the people. So no accountability on their promise when they were giving us during the negotiation, no responsibility towards the people. They want the rest of the world to feed them. And we think still that there is not enough engagement. We justify the Taliban's barbaric act by saying that because we didn't engage and we didn't recognize them.
Yeah.
Probably this term of recognition should really be interpreted. What does it mean when we say recognition? I believe personally that women's rights in Afghanistan is not just a matter of women's rights in Afghanistan. It's a matter of global security. And therefore, we have to really look at it from that perspective and pressurize Taliban, sanction Taliban and their supporters, their funders. Charge them on the ICC on the basis of crimes against humanity. If this happens in your own borders, in your own shores, will you really simply simplify it to the extent that because we haven't been engaged with them, they're doing so? No, because we have given them so much privilege by engaging with them. They are traveling with private jets while women of Afghanistan cannot travel.
I like the point that you're making, that the narrative now needs to be rewritten. You cannot play the victim anymore. You need to have boundaries set clearly. You need to have more pressure being mounted by political representatives worldwide. I like the point that you're making, but essentially I'm trying to understand how should the international community even view what is happening, James, and this is what I want to bring you back in. I said this when I started talking about this issue, that when Taliban came back to power in Afghanistan, they said it was going to be a new chapter, but nothing really has changed, has it?
Indeed, I think that the expectation that they were going to be accepted within the family of nations hasn't worked out for them. The international community has basically demanded that they put up an inclusive government. The government that they have put up is not viewed as inclusive enough or inclusive at all. And as a result, Afghanistan is an internationally isolated country. Various nations engage with them informally, if you wish, to different degrees, but have not returned their embassies to Kabul and have not been willing to engage in terms of providing the sort of economic and humanitarian aid that Afghanistan needs. And as a result, I think what you're seeing is the hardliners, the ultra-conservatives within the Taliban, basically saying, we don't need to make concessions because we're not going to get anything in return. And on top of that, we're being challenged by the Islamic State and must respond to that.
So, James, what I'm essentially also trying to understand is that if you see the pattern of what's happening in Afghanistan, there is an understandable degeneration every day. In November, they prohibited women from going to parks, fun fairs, gyms, and public baths. Women have also been pushed out of many government jobs or are being paid a slash salary to just stay at home. They're also barred from traveling without a male relative and must cover up outside of the home, ideally a burqa. So what really can the international community do at this point?
Well, there's very little that one can do without basically direct intervention. Aid is frozen. The Taliban are frozen out of diplomatic engagement with the international community on a whole variety of issues that are crucial to them. So as a result, and the notion that that pressure was going to push the Taliban in a more moderate direction has proven to be wrong. It's pushed them in the other direction.
Well, really an unfortunate reality and easier said than done for people who are actually not in Afghanistan. Fawzia and James, a pleasure speaking to both of you. Thank you so much for taking our time and joining us here on CNN News 18. We're now shifting our focus. It's back once again. If we thought COVID is behind us, well, that doesn't seem to be the case. Videos emerging from China indicate that all is not well. Top epidemiologists are now suggesting that infections could wipe out 60% of Beijing's population. As per reports, crematoriums in China are taking cremations 24/7. For India, the worry is what happens in China doesn't stay in China. What is BF.7, the variant which has now been detected, unfortunately, in India? How effective are our vaccines against it? And how should we prepare ourselves? To answer all of this, we have with us our newsmaker for this evening, Dr. Randeep Guleria, the former director at AIIMS. Doctor, always a pleasure speaking to you. Thank you so much for taking our time and joining us here. As I said, there is a bit of anxiety, there is a bit of panic because people are not very clear of what really is happening, whether India will see a similar pattern like China or not. So let's really begin with the basics. What do we know so far as this variant is concerned? Is this Omicron or is this something else?
So whatever data we're having is suggesting that the variant that we're looking at is B.7, which is in sublineage of the Omicron variant, the B.5. And what it's being seen is that this variant is having two properties which are of concern. That is, it is more infectious. It is spreading more rapidly than the previous variants. And it has also got an immune escape mechanism. That is, it's able to escape the immune protection that we've had because of past infection or because of vaccination. So those are the two things that this variant is showing. But what we're seeing in India, this variant was reported in October. But since it's being reported in October till now, we've not seen any surge in the number of cases in terms of hospitalization or in terms of deaths. And therefore, it's still causing more mild illness rather than a severe illness as we're seeing in China.
So, Doctor, you said this is the variant which is now being called BF.7. Unfortunately, we already have about 4 cases of this new variant which have been detected from India. How different is it from the previous variants?
So the only difference that we're seeing, and the difference is actually the important issue to understand here is why is it behaving differently in China as compared to India? These 4 variants that we have seen were reported in October itself. But we've not seen a surge in the number of cases. We're not seeing a huge increase in hospitalization.
True.
And as a matter of fact, our cases are actually much lower than what we've ever had before. And that's because of the fact that we've had a very good aggressive vaccine policy. Almost the entire population has had 2 doses of the vaccine, and people are being encouraged to take the booster dose or the preventive dose. And along with that, many of us have had natural infection, and therefore there is a good amount of immunity in our population. The situation in China is different because China adopted a zero COVID policy.
Yeah.
They had lockdown, even there were very few mild cases. And therefore, there is a large part of the population which has not been exposed to the virus even naturally or has not taken the vaccine. Therefore, their population is like we were, let's say, in 2020, early part of 2020. where we had not been exposed to the new virus and we had no immunity. Because of that, with the new variant, they're seeing a surge of number of cases, and they're seeing more admissions in the high risk group and the elderly because they're not vaccinated and they've not got any natural immunity because of infection. We are in a better position because we opted for a different solution.
Okay.
And therefore, I think the situation is different. But we need to be vigilant because we know that as the number of cases increases, the virus can further mutate. And therefore, in terms of severe illness, hospitalization is something that we need to closely monitor.
Sure.
We must encourage people to come forward to get themselves tested, and genome sequencing should be done so that we are able to pick up any new variant early and see how it's behaving in terms of hospitalization, deaths, spread of the infection, and in terms of evading the immunity that we have because of vaccines.
Well, that's true and that's heartening to hear, Dr. Guleria, but I also want to understand where we stand currently. Realistically speaking, our testing is not so aggressive anymore. Do you think that's where a priority should be, to get more testing done?
I think so. I think we need to increase testing. What is happening currently is a large number of people feel that COVID is over or that now it's a mild. Many people have flu-like symptoms which look very much like COVID, but they would not get themselves tested and they would just take symptomatic treatment. They may even isolate themselves, but testing is something that they're not coming forward in doing. There are also some people who do the rapid antigen test.
Yeah.
And if they are positive, they don't report it, they don't get the RT-PCR done, and they also just isolate themselves. Therefore, we don't have two databases. One is the actual number of cases. I think we don't know because unless you get yourself tested, it will never be recorded. And if your rat is positive and you don't report it, it will also never be recorded. Secondly, unless we get more testing done and people come forward and get themselves tested as a responsibility, we will not be able to pick up new variants or be able to see how they are behaving. So I think we need to do two things. One is encourage people to come forward and get themselves tested if they have flu-like symptoms, and get the RT-PCR test done so that genome sequencing can be done. And secondly, we have to have aggressive surveillance in hospitals across the country so that if there is an increase in cases of flu-like symptoms, patients getting admitted in the ICU or in the hospital, their genome sequencing and testing is done on a regular basis.
Sir, I just want to go back and talk about the patterns that we're seeing from China to India. Now, a lot of experts are saying the reason that we're seeing these surge in cases in China is because their efficacy of vaccines is questionable as of now. Compare that to the vaccines that we've taken here in India. How effective are they against this new strain?
So the data that we have currently as far as vaccines in India are concerned, and this has been now published in a large number of journals and been peer reviewed and done by many groups, including researchers at the All India Institute of Medical Sciences, suggest that the vaccines do protect us against the new variants also to some extent, and therefore these vaccines are robust enough. As far as the Chinese vaccines are concerned, we don't have that data. We don't know how effective they are against the new variants because that data has not emerged from China. And therefore, whether they should look at new vaccines or get vaccines from outside to vaccinate the population has always been a question which one has not been able to find an answer for, and China is not willing to do that. In our case, I think we have robust data to suggest that currently the vaccines are helping us protecting our population against severe illness, hospitalization, and death. Yes, we will have cases. The vaccine is not that effective against getting the infection and stopping the spread of the infection. So that will continue. But I think that's all right as long as we don't have severe cases or hospitalizations or deaths.
Dr. Guleria, now, of course, I want to talk to you about what we should be doing as of now in India. The first question that everybody wants an answer to is, should India ban flights? Do you think that's a rational approach?
No, I don't think so. Banning flights now is an option. That was something that had been done in the early part of the pandemic. But now, like I said, we also know that B.7 is already present in our country since October. So banning flights is not going to really be of much use. Secondly, we know that people travel from different hubs, whether it be the Middle East or from Europe. And therefore, trying to really stop travel is going to be very, very difficult. It's not usually effective. What I would say is that we should encourage people who travel and who have come from outside and develop flu-like symptoms, develop symptoms which suggest that it could be a COVID infection, should come forward, get themselves tested,
Yeah.
and a genome sequencing can be done to see whether in them there is any new variant so that we can pick it up early. So people should feel that responsibility and get themselves tested if they have symptoms if they come from outside. But banning flights totally would be, in my mind, counterproductive and will not be really very helpful.
Okay, the other aspect that a lot of people, of course, had some queries about is what about the booster dose? We do know that the numbers aren't very high as far as people who've taken that precautionary or booster dose. Do you think that will also now become a priority and more people should come forward and take that jab?
Yes, I think so. I think this is something that we need to push for because a large number of people now have started saying that COVID is over
Yeah.
and therefore we should not take the precautionary dose or the booster dose because now there is no need for it. I don't think that is true. COVID is not over. We are still seeing cases in our own country and we're seeing cases also in different parts of the world and a huge surge in China. Therefore, for all those individuals who are due for the precautionary dose or the booster dose, I would really say or urge that they should come forward and get themselves vaccinated. It will protect them both from getting severe infection, hospitalization, death, and to some extent, it will also protect them from getting symptoms of long COVID. And therefore, I think everyone should come forward and get themselves vaccinated. That has come down dramatically, and
True.
that is also a cause of concern.
Lastly, Dr. Guleria, this is the holiday season. We all thought it was behind us. Going into 2023, how prepared is India?
So I think India is well prepared from 2 points of view. We've learned a lot of lessons from COVID, and therefore we had a very aggressive and good vaccine policy. And research, and as far as the vaccine front is concerned, is
Yeah.
very good. We have number of vaccines now available in our country, and therefore, as far as COVID is concerned, we are in a better situation from the protection point of view as far as vaccine is concerned. We also have a good surveillance system, the INSAGOG, and that is also very helpful. And also, I think the healthcare facility is better geared up than ever before to manage outbreaks and pandemics. And therefore, we are in a better position than what we were 2 years ago. But I think we still need to continue to be vigilant
Yeah.
and be prepared for any outbreak that may happen. It could be COVID related or it could be related to other viruses. And that is something that we need to do in the new year, that continue our aggressive surveillance and monitoring for new outbreaks and new variants as far as COVID-19 is concerned.
Dr. Guleria, always a pleasure speaking to you. So there you've heard from the top health expert that you need to go back to the basics because it's not over. So wear a mask, wash your hands, sanitize yourself. And if you haven't taken that booster or precautionary vaccine, do go forward and take it. Well, with that, it's a wrap from my side. Thanks a lot for watching.
Taliban made promises to the people of Afghanistan and to international community that schools would reopen. Now, to get us more details on this, Abhishek Jha continues to be with us on the bulletin. Abhishek, that's a strong statement coming in from the US government now.
Yes, Vinaya, and also we'll have to see that these statements are coming at a time when Taliban is starting doing all that it was anticipated or people were fearing of that Taliban will start doing these things. Uh, there were a lot of opinion and experts try to allay those fears of Taliban and saying that let them have another chance. Maybe Taliban have changed. Taliban the 2-0 have little moderate views on the fundamental aspect of his theology and ideology. But it looks like with almost more than 1 years being there in Kabul, Taliban is strictly trying to implement what it was fundamentally an organization of very conservative theories and conservative concepts regarding society and how it should operate. While it is having a relation with some countries in the region, these issues of women education, issues of minority communities, issues of non-inclusive government that Taliban is currently boasting, and uh, discriminatory ways of dealing with people, their primitive way of punishing people, law and justice system. everything is very sham. And with the United States also saying that the decision of not letting women have education is an indefensible decision.
The Taliban has officially announced the suspension of women's education in Afghanistan. Taliban has announced the closure of universities for women in Afghanistan. This is according to a letter by the Taliban's higher education minister. The letter states that all universities will remain closed for women until further notice. Top sources in Taliban told CNN News 18 that this ban is temporary and they will come back with new curriculum soon. Protest has started in Kabul last evening after this announcement. Earlier, Taliban had banned secondary education also. Now, to give us more details on this, I am being joined live by my colleague Abhishek Jha. Abhishek, further gags on women's freedom?
Of course, and this is not the thing that was not being expected, because initially, ever since Taliban has came into power in Kabul and almost all of Afghanistan, they have tried to increasingly ban women's participation in social arena. That includes education, because that is one of the most important area. Initially, they barred women from going to colleges. Then they separated, uh, boys students from girls students. The classes continued. It was always a hiccup. It was always difficult for women to attend classes. In fact, in various rural areas of Afghanistan, women were barred from having even primary education. So there were multiple type of prohibition imposed on women education in Afghanistan. But now with the latest dictate that has come from the Afghanistan's official minister, it looks like the total blanket ban has been imposed in women education. And it is coming at a time when world is increasingly integrating women workforce in its prosperity, in its development. And Afghanistan, which is dealing with a lot of economic crisis and social crisis, at this time it is trying to prohibit 50% of its population from becoming part of its mainstream growth, is something that is not going to do well to the Afghanistan economy and its social milieu.
Abhishek, the last time on such a clampdown was imposed, we saw some protests happening. This time on, what is the reaction that's coming forth?
So there has always been protests. In fact, we have seen how women, like even in small groups, they tried to come on streets and protest to Afghanistan. They stood guard to colleges and students and schools. They tried to protect their rights, even in the thrashing, in the face of thrashing and beating from Afghan soldiers.
The government of India says and reminds the Congress party that
we all may have our own political preferences, but this word or this idiom Jai Hind is above all. You ask an athlete what the flag means, what playing for the country means. Ask a soldier